discuss this now with Rana Jawad Asghar. He is an epidemiologist and the CEO of Global Health Strategists and Implementers, and he joins us now live from Islamabad. Thank you so much for being with us on the program, Doctor. Now, we're getting reports of more flooding in the south, and it seems like the situation there is going to get a lot worse before it gets any better. What are we going to witness?
Thank you for inviting in your program. The situation is really critical at this moment because Sindh province, our southern province, has first faced the first wave of floods, which came from the northern side of the province. But now from the flood is going to reach, which started in our northern hilly areas, and that water is reaching to the Sindh in these days. And the problem which the NASA film has showed, the photographs has shown, that the Sindh is being converted into hundreds of kilometers long water lakes. And that's the problem because, contrary to our northern hilly areas, where even if flood comes, they passes very quickly. Once it reaches in the plains of the Sindh, the water spreads and stays for much longer period, and
Right.
that creates human misery there.
Right. It does create human misery. It also poses a great risk for waterborne diseases. How life-threatening are these diseases that we could see emerge from this catastrophe?
So multiple type of diseases, and as an epidemiologist, my biggest worry is that how to prevent any cholera outbreak in that area, because the quality of water is, it's not safe to drink water in most of the places, and that's the biggest threat for any major disease outbreak. But Sindh province has already a history of typhoid fever, and that typhoid fever, which what we call extremely drug resistant. And Sindh province is the only place in the world where we are already facing a major outbreak of this typhoid fever. And right after the monsoon, and because of the water, it will be staying in a huge area, all mosquito-borne diseases are a major issue alongside other waterborne diseases. So dengue, malaria, chikungunya, three most common diseases which are already prevalent in Pakistan. We can see their number rise.
Right, and I understand that you can only keep yourself safe or prevent yourself from catching this diseases to an extent, but what could the people of Pakistan in the most affected areas of Pakistan do to stay away as much as possible from getting infected?
I think it's more than people. It's the government responsibility to provide them clean water. If they can ensure, safe drinking water to this population, only that can save thousands of lives, because we will be able to, prevent all those diseases which are waterborne. So that's the number one thing. Then the government has, because a lot of pregnant women are displaced, a lot of younger kids have been displaced, and these are hundreds of thousands of people. So the government should step forward and provide them, the emergency medical relief services, including vaccination or immunization for young kids, and maternity care for the pregnant women, because they are away from their houses, they are open in the air. And so these are the critical areas of the health system which need to be supplied by the government. People on their own cannot do much about those issues.
Right, and we're aware that at least 75,000 pregnant women have been affected by the floods there. All right, Dr. Rana Jawad Asghar, thank you so much for joining us here on the News Hour.